Hi, I'm Patty Ducaye, your Texas State Long-Term Care Ombudsman, and I'm here to talk to you about a new temporary policy for all ombudsmen who are making facility visits. So starting October 1 of 2021, I'm requiring that all of us get routinely tested for COVID-19 and make sure that we have a negative result before making a facility visit. For every ombudsman who visits as a staff ombudsman and every volunteer who visits at least weekly, you'll test once a week. And we call that surveillance testing, meaning you're testing when you don't have symptoms of COVID-19. For volunteers who visit less frequently than once a week, then we'll ask you to have a test done the day you're going to visit before you make your visit. All of us will need to build in a little extra time for this testing. We're providing you with COVID testing that you can use at home that is safe, accurate, and will be private. We also think it'll be comfortable because it's a test that is done with the lower portion of your nostril here. It is not a test that goes deep into your nasal cavity. So you'll keep that little swab right down here in the entry point of your nose. A positive result means that an ombudsman cannot visit. You're not required to report your result or report your health information to your managing local ombudsman, but if you won't be able to make a visit that you're expected to make, just notify your manager that you won't be able to visit. You could set the date of how long that's going to be. Make sure that it's at least 14 days. And we'll make sure that staff are on hand to help and respond to any needs that the residents have at your facility. Okay, so with CARES Act funds, which are federal funds for the disaster of COVID-19 and exclusively for the Ombudsman program, we have bought these at-home tests that we've gotten orders and will continue to get new orders available to us. We've bought something called IntelliSwab, so here is the box and how it looks. Inside each box are 2 tests. I'll show you how to use a test in just a moment. 1 tray to hold a solution that's inside. A detailed instruction sheet with lots of photographs to make it clear how to do things. And a smaller sample of what a positive test result can look like. You'll have one of these in every box. A positive test result is a very faint to dark line. Any line on the second part or the bottom part of the test will be a positive test result. So the last thing in the box that I mentioned are 2 sets of this test. So this has the test swab on top, and that's in a kind of a separate packet inside this one. This is your vial, the solution that you'll use and set upright onto this little stand and then dip your swab into. Now the first instruction is that we wash our hands. So I'm going to take a break, wash my hands, and come back to you. Well, I'm back, freshly washed my hands, and now I'm ready to get started. The instructions tell me to have ready a way to set a timer for 30 minutes is what we'll eventually need to set. Have one of these packets available, have the stand ready to go, wash my hands for at least 20 seconds, then open the bottom pack to get out the vial. Here's an opening. This is the small vial. It says, do not drink it, obviously. Do not pour it out. You're going to need the solution in here, and we're going to set it on the table here, holding it up. I'm to open it. Hold the tube upright while I take off the cap and set it in place. Okay. Next, I blow into a tissue. and I don't wipe inside my nostrils. The idea is that you're moving any material inside your nostrils, upper nostrils, down into the base of your nose. So again, blow it to the napkin, but do not clean out your nose. Next up, we're going to open the testing strip. I've pulled out with the place where your hand is going to go. Don't touch the flat pad, it says, with my finger, so don't touch it. Now I'm going to insert into my nose and move it around in a circular motion 15 times. 7, 8, 9, 10, 11, 12, 13, 14, 15. Now I move into my other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Easy, painless, I promise. Now we're setting it into the liquid, and it says to turn the liquid in this 10 times. So turn the item around. 5, 6, 7, 8, 9, 10. Make sure the tube and device are at an angle. Leave it sitting there. Now set my timer for 30 minutes. Hi, just a quick check-in to show you that I'm watching something happen on my test results. So what I notice is that it's turning pink inside the area I'm going to read. And I'm starting to see something dark emerge on the top line that's marked with a C. The bottom line is marked with a T, and that's what I'm going to need to watch really carefully to see if there's a positive result there. Then the line next to the T will be some color. I'll check back with you when I reach 30 minutes. Well, good news, I've reached my 30-minute mark and my results look good. No positive signs here. I read the instructions carefully, which are really nice and thorough. They give us a lot of examples of what is an incomplete test, what to look for if something isn't good enough and you just need to do it again. A second is your potential positive results are shown to us. Lots of variations that can occur. Any line on the second line marked T is an indication of a positive result. And then finally, the only negative result, which I luckily have today, is only the top line is a nice dark line showing no semblance, no faded, pale indication on line T. Only my top line C has a nice bar. It runs from left to right, a complete one, and all that background pink color has faded from the test result. Notice that in the instructions that you only have between the 30-minute mark and the 40-minute mark to read your results and get an accurate result. So it's actually really important that you set that timer and pay attention to it. If you walk away and forget about it and you come back to look, you may not have anything to look at and it won't be a reliable, accurate result. So take this time, make sure that you're setting aside that time to do it. Thanks again for protecting the health and safety and welfare of residents, for protecting your own health in these very difficult times. Thanks for wearing that PPE, getting vaccinated, and now testing for a quick period while we're under some difficult circumstances in Texas. We appreciate your cooperation. I appreciate all that you do to help others. Thanks for being a part of the Ombudsman program.